Good evening. I'm Corvallis Advocate Assistant Editor Kara Nixon, and co-moderating with me tonight is publisher Steve Schultz. Welcome to tonight's CitySpeak Forum. CitySpeaks are presented by the Corvallis Advocate, which offers daily news online and, in non-pandemic times, a twice-monthly deep dive print publication along with live forums and storytelling nights. CitySpeaks are co-presented by City Club of Corvallis, a volunteer-run nonprofit organization that seeks to present a diversity of viewpoints and constructive dialogue. Viewers that would like to submit a question for tonight's guests can comment on the event's live post on our Facebook page, The Corvallis Advocate, or email us at cityspeak@corvallisadvocate.com. Again, that's cityspeak@corvallisadvocate.com. Steve?
Thank you, Kara. Next Tuesday, during National Hunger and Homelessness Awareness Week, CitySpeak takes its annual look at homelessness locally. Also, about these panels generally, partial funding for these forums comes from Peak Sports and First Alternative Natural Foods Co-op. However, they only pay a portion of this. We really can't do this without the support of viewers like you. For those of you that are already subscribing, we really appreciate the support. If you're not already a subscriber, visit our site. Consider the $5 or $10 level of monthly subscription. We really do appreciate the support. They really do make these panels possible. And further, it's an opportunity to support something that is increasingly rare, locally run journalism. Kara.
Thanks, Steve. Tonight, Corvallis State Representative Dan Rayfield reviews the legislature's work this last year and previews what to expect for 2021. But first, we get an update on the COVID-19 pandemic from some local experts, starting with editorial board questions and then moving to audience questions. First, we'd like to welcome Charlie Fautin, who is the county's interim health department co-director. Our first question for you, Charlie, is where do we stand today and how does that compare with other counties within Oregon and nationwide in regards to the pandemic?
Thanks very much, and thanks for the opportunity. Just a quick correction, no longer co-director. We have a new health department director, Suzanne Hoffman, and so Danielle and I have reverted to our previous incarnations as deputy directors. But be that as it may, we are seeing an increase in cases of COVID here locally, a pretty dramatic increase, actually. That is mirroring what's going on in a lot of the rest of the country. Fortunately, not near as badly so far. Oregon has done a very good job, and Benton County in particular has done an excellent job. The people here have been very cautious and so far have been able to hold off the worst that this virus has to offer. But it's really getting a foothold now across the state and locally, and we're starting to see some pretty concerning increases.
Thank you. And then have the drivers for transmission changed from early on in the pandemic to now, most especially locally?
So early on, we were seeing cases in some workplaces, not of the size of the kinds of things that we're seeing in Lincoln County, some other parts of the state, in Lynn County in large employment bases, but we were seeing that locally and in long-term care facilities, which was really concerning since, obviously we've got some of our most fragile community members in those locations. What we've seen in the last couple of months is a real change, and the vast majority of our cases are occurring in everyday social gatherings, in households, in families. In the last few days, we've started seeing a lot of cases coming out of Halloween parties. We're seeing cases come out of parties where people are watching sporting events, birthday parties, weddings, things like that. 10 is not a magic number. If you have 9 people there, you're not protected if one of them is carrying the virus, and we're getting 5 and 6 cases out of groups of 10, even some fairly short gatherings. So that's really what we're seeing now, is these small group people, eating, drinking, having their masks off, being with people they know and they feel safe with. But in reality, anybody can be carrying this, and As the governor said today, sticking within your household right now is probably the safest bet.
And then going off of that, what impact have OSU students had on transmission?
So just having a larger population in Corvallis has led to more cases. We saw the bump when students came in and they did the move-in testing, and students were required to be tested. And that seemed to box in a lot of cases. And we had a decrease following that. I think like everyone else, students, and maybe to a larger extent, just given their age and the social nature of young adults, there's been a lot of socialization. And so if there's more socialization there, there's more cases. It's not exclusive to university students, but we're certainly seeing that come out of those group gatherings among students.
Thank you. Next, we'd like to welcome Dr. Adam Brady, who is an infectious disease specialist for Samaritan Health. Adam, could you let us know what happens to hospital capacity during most flu seasons locally?
Yeah, thanks for having me. And at Samaritan, as well as other places around the state and the country, winter is a busy time for hospitals. People with underlying medical conditions or difficulty breathing or pulmonary comorbidities are more susceptible to not only the flu, but other viruses that circulate in the community. So typically around winter time, we do see increased hospital census, and that's fairly usual for a regular flu season. Now, the upcoming flu season, there's a lot of questions surrounding it, whether, how bad it will be, if it will be at all. And so we're taking precautions to ensure that we have adequate capacity to deal with not only COVID-19, but the concern for other respiratory viruses as well.
And then where does hospital capacity sit now? And if you have any specific percentages or anything, that would be great.
Yeah, so hospital capacity is always sort of a moving target. So, it can, on a day-to-day basis, 30 people can be discharged from the hospital and that percentage goes way down. So what we have seen, though, is increase in the number of hospitalizations around our 5-hospital system, not just in Corvallis, in the number of COVID-19 patients that we're taking care of. We still do have adequate capacity to take care of more. Again, we are mandated by the state and by the governor and OHA to keep a certain amount of beds open for a potential surge in COVID-19 patients. And if we don't meet that threshold, that means we may have to start backing off on some elective surgical procedures or other things that may drive hospitalization. So currently, again, cases are skyrocketing around the state and around the region. And so I don't think we've seen the peak in cases. And normally hospitalizations follow about a week or two later. And so we're at this point, we are seeing as a 5-hospital system, more cases of COVID-19, more people with COVID-19 being hospitalized than any other time in the pandemic. But we do remain with adequate capacity at present, an adequate number of ventilators and ICU beds at the moment.
Great, thank you. And then you kind of touched on this, but if capacity is exceeded at the hospital, what does Samaritan have in place to help solve that issue?
So as early as February, March, when the pandemic was really in its infancy, we have developed a coronavirus task force. That task force works very closely with, across the entire Samaritan system, as well as a surge capacity or a surge committee as well. So each of the 5 hospitals has their own surge plan, which details what to do in times of staffing shortages, in times of bed shortages, where how people move through the hospital or transferred from hospital to hospital based on bed shortages. We saw back in March that the governor ordered really almost a shutdown of non-essential medical services. And that obviously is a last resort, because we saw some adverse effects from that with people coming in sicker months later and maybe even continuing to come in sicker because of deferring medical care. But that is sort of a last resort option, is to disrupt the normal day-to-day operations at the hospital to conserve space.
Thank you. Now we'll be moving on to Danielle Brown, who is serving as the county's health department deputy co-director alongside Charlie, and her work focuses on mental health. Our first question for you is, are you seeing an increase in mental health needs, and what issues are arising in relation to the pandemic?
Yeah, thank you for asking that question, and thank you for inviting me to be here tonight. We are seeing an increase in individuals who are experiencing depression and anxiety. I think, everybody that is living in the coronavirus world right now is experiencing different mental health symptoms related to the isolation and the sense of fear and dread that we've all experienced with coronavirus. So, at this point, we haven't seen a significant increase in demand for services. We're still continuing to have our pretty steady regulars come in asking for service, but we do expect that we're going to see an increase in depression and anxiety related to coronavirus, especially as we move into the winter months with the shorter days, less ability to get out in the outdoors and enjoy things that people enjoy. We all have not we all have, but there is seasonal affective disorder that we see increase this time of year. So we don't know how to project how that's going to impact or be impacted by coronavirus and COVID isolation. But we have seen an increase in everybody, even just coworkers, experiencing mental health conditions and needing some additional support.
Thank you. And last time you were with us, you pointed to an anticipated spike in drug and alcohol issues due to the pandemic. Are we seeing that at this point?
That's a little hard to substantiate at this point. I think we're seeing that anecdotally, but I don't think we have any evidence of that at this point yet. We haven't had people increasing coming and asking for alcohol and drug treatment services. I think we'll see that after the pandemic starts to subside and when the vaccine comes out. When people feel like their life is supposed to be getting back to some level of quote unquote normal is when we'll see individuals coming in and increasing rates asking for alcohol and drug treatment services. I think anecdotally we've seen, a variety of social media posts and things like that where it feels like everybody is drinking to manage. I realize that that's probably not necessarily a good measure, but I think that is indicative of what people are doing to cope with what's going on right now.
And residential treatment capacity has been an issue in the past. So how has the pandemic impacted that?
Residential treatment continues to be a concern for bed capacity. Actually, COVID has impacted that pretty significantly because of the difficulty getting folks original or pre-COVID into those residential beds was difficult just because the beds weren't available. Now we have COVID to deal with as an additional barrier to getting people into treatment. So, in addition to having limited bed capacity, now we have to make sure that the person has a COVID test and has no symptoms before they're allowed to be admitted into any level of residential treatment, which is just another barrier for people getting in.
Thank you all for answering our editorial questions. We'll now turn to audience questions. Steve?
Thank you, Kara. I will start out with Charlie and Adam, if I can. I'm going to ask you both to answer these questions, if you would. So really, where do we stand? Let me get back over here. Right. At this point, what do we know about treatment that we did not know a few months ago? It seems like the mortality rate for hospitalized has decreased. What are we doing right? I'll start with Adam.
Yeah, so a couple of things have changed since the beginning of the pandemic and over the last few months. One, our knowledge of the disease has improved. Again, treatment or a particular antiviral medication or a targeted treatment isn't the only way to manage COVID-19. There's been more advances in how people are managed on ventilators, or maybe even strategies to prevent people from becoming sick enough to need a ventilator that has helped. We do have the first FDA-approved medication to treat COVID-19, which is called remdesivir. Again, not really a silver bullet medication and a little bit controversial as far as how robust the data were that went into the decision to approve that. But that has been shown to possibly decrease hospital stay for people with COVID-19 that are sick enough to be hospitalized. The medication trial that showed the most benefit was one out of the UK that looked at dexamethasone. So dexamethasone is a steroid medication, and thus far has been the only targeted treatment that has been shown to decrease the mortality from COVID-19. And if it's given around the time where you're sick enough to need oxygen, it can prevent the progression to needing ventilation and death. Interesting thing is if it's given too early, say out in the community, or if you're hospitalized but not really requiring oxygen, it could even potentially prematurely blunt the immune response and lead to possible worse outcomes. So really only a medication for hospitalized people at this time. Earlier in the pandemic, we had lots of different studies looking at repurposed anti-malarial drugs and antibiotics that haven't really shaken out to show much promise when put to rigorous trials. Even this week, a monoclonal antibody treatment was approved for use, and this is going to be one for outpatients. So it's an intravenous medication that this class of medication was made popular by President Trump when he was sick earlier in October. But this is a different medication from Lilly that was just given an emergency use authorization that has the potential to decrease the risk of hospitalization, and is tentatively approved on an emergency basis for those with pre-existing conditions or that are at high risk for complications of COVID-19.
Right now, about how many doses are we going to wind up needing? Do we have any idea? And how many are coming to Oregon? And we don't have them yet, right?
No, this is all very preliminary. And I saw a draft website today. Again, it's sort of, the numbers come when they come, and the distribution is from the federal government. I saw the initial shipment for Oregon might have been around 400 or so doses.
Okay.
We don't know how many of those we're going to see in our 3-county area.
Right, and then really this is going to be for the most at-risk patients, over 65 and comorbidity.
Most likely. Again, there's a lot of logistical challenges with this medication because it is IV only. And so it's really best given as soon as possible from the time of diagnosis. So there are logistical challenges when we're bringing people in that are infectious with COVID-19 to places to get an infusion where we may not deal with typically infectious patients. And so, and you have to be monitored for an hour after the infusion. So you're really a 2-hour sort of ordeal. And with limited doses, we may have to even be more restrictive to the highest risk, and those may be most likely to benefit.
Okay. And then Charlie, do you have anything to add to any of that?
No, I want to take my hat off to the medical providers, and especially the intensivists and the people in the emergency rooms, intensive care, who've really made incredible stands with no new medications, really learned how to deal with this. The one thing I do want to add is around sort of the lower level infection that is much, much more common, where people have low level symptoms or very few symptoms at all. But what we're seeing is this long haulers syndrome. We don't know much about that. We don't know how common it is. We really don't know the sequelae. From a public health point of view, it's really very concerning. This could be a major source of pre-existing conditions for a long, long time. And it's something that public health is going to want to watch extremely closely for decades.
I'll follow up on that a little bit with Danielle. Have you encountered as a patient anybody yet long hauler and they're trying to get through this? Have you encountered any of that at Benton County Health?
Not in the behavioral health work. We haven't. Not that I have seen. No.
Right. Okay. Because that's got to be trying. Okay. Similarly, there was another medication that's not approved yet. It's a Pfizer vaccine, supposedly 90% effective. Heard about it the other day. Good news. But of course, it's got to be distributed and so forth. And Charlie, I'll kind of start with you first. What do you know about the Pfizer vaccine and availability and potential for beyond healthcare? Because the first round is going to go to healthcare workers, as it probably ought to. But what do you know?
Yeah, so this is a new manufacturing method. This is what's called an mRNA vaccine. We don't have any currently in widespread use. It's been a model that has been used experimentally, and it's really encouraging if these early trials prove out. That's quite an astonishing effectiveness rate, and I was especially heartened that it showed that sort of response in older people with an underlying burden of disease. I think you're exactly right that first rounds of this vaccine are likely to go to frontline hospital and healthcare workers, to long-term facilities, to medical first responders. It's going to challenge our system of distribution. And the other thing, I don't want people to get ahead of themselves on this. I worry that we've all watched too many movies, and the minute a vaccine is announced, the music comes up, and the hero is crowned, and everything's over. It's not the way it works in real life. A vaccine actually has to get out there and get into people's arms, and in this case, it'll take 2 doses 3 weeks apart. So on top of the challenges of getting distribution and administration, it's going to take an extra month or so after the first round before there's really any much effect in the people that are vaccinated. So we're in for a while here before there's really widespread use.
I mean, I'll ask it a little bit different way. Let's say you're a 35-year-old restaurant worker. If you're a 35-year-old restaurant worker, or maybe a grocery checker, when do you think that person is going to be able to realistically get a vaccine?
So this is kind of my mantra around this. I think we are in for, unfortunately, a pretty dark winter. It's going to be hard to beat this down. And
Right.
I really would ask people, and that restaurant worker and people like that, to please, please, please hang on to the precautions that we know work, that have worked for several months now, because we need about 6 to 8 months more of your time. We're really looking at next summer before there will be wide enough availability and enough people vaccinated and enough people with the second dose to really start relaxing our precautions. I hate to say that, but we're looking at, really, in my mind, until we can get outdoors again.
No, that's why you're here, is to deliver us the news, good or bad. So I appreciate that. And then Adam, I want to go back to you. And do you have anything else to follow up with what Charlie has said about the vaccine? It looks like it's headed for approval. I don't know if it is or if it's not.
Yeah, and all these data are from a press release so far, right? So I think it is cause for minor celebration. I think this is the first vaccine, any sort of vaccine data we've seen for this organism. Again, with influenza vaccines, we see effectiveness from 40 to 60%. The FDA had put some criteria together for an emergency approval, with aiming for around 50% for a COVID-19 vaccine. So we have no idea if this was going to be a 50% or a 90%, or if a vaccine would work at all for COVID-19. So the fact that even this preliminary data show that you could reach 90% with their interim analysis, I think that's cause for some cautious optimism. Again, we'll have to see it all the way through, and there'll have to be more safety monitoring data before it gets fully approved. But the takeaway is that a vaccine can likely be made for this pathogen, which is cause to be optimistic. And like Charlie said, it's going to take a while before we get this fully deployed and manufactured. Pfizer said they could come up with 50 million doses by the end of the year, and potentially over 1 billion doses by 2021. Again, that's something that we need to keep an eye on. And again, CDC has a vaccine playbook. The Oregon Health Authority has a vaccine playbook that details sort of a phased approach to vaccines, with phase 1 being these limited doses. Maybe we might even see at the end of this month or in the coming months for healthcare workers, those at high risk, even potential certain essential workers. We have to look into that a little more, and we'll get more guidance from our government partners on that. But again, we still need to see the final analysis. I still want to see the final data on this. And the other question is, we don't know how long the immunity will last, right? And so that's another question that's still out there, and a major question, because if it's 90% effective, around the time of the second dose, we want to know if it's going to continue to be effective months later, and that's just going to take time to know.
Okay, and then the other thing, I guess it's a bit of a loaded question, given what you know so far and what you can maybe find out. Is this a vaccine that personally you'd recommend to a family member or take yourself at this point? Or you obviously probably want to wait for a little additional information beyond the press release, but does this look encouraging from that standpoint of you would tell a family member, be encouraged?
I would, yeah. It is too early to make recommendations, based on the limited data that we've seen. But, having poured over the phase 1 and 2 data for safety for this vaccine, there are some mild side effects, like with any vaccine, mild or moderate, reactions and headache and things like that. But there have not been any serious safety signals so far. This is not one of the vaccines that had to be halted to investigate potential adverse reactions to the vaccine, which is also encouraging as well. So I haven't seen anything so far that would make me say stay away from this vaccine. But again, before we fully deploy this and roll it out, we need to, as a community, go over all the data and make sure that it's something we're comfortable giving.
And certainly by the time it's available for somebody like me, it's already been through the healthcare workers. So on some level, I hate to put it this way, in some ways, you folks are also going to be guinea pigs in some ways.
And I would push back a little bit to say we're guinea pigs, because if we're not comfortable with the vaccine as an organization at Samaritan, one, or as a infectious disease community in Oregon, that's not going to be something that's going to be forced or required or experimented on. So I think we'll have to have full confidence in the data so far to be able to, in good conscience, recommend it for our colleagues.
Yeah, at some level, my indication is to just say that most often, by the time something gets to general public like this, it's been through healthcare workers, so you have additional data as well.
Yeah, and the studies will be more mature at that point. They're not going to stop monitoring people after the after this interim analysis or even the final analysis. So they'll keep in really phase 4 looking at post-market effects with this too.
Right, now this questioner would like to know, and I think this is again going to be for Charlie, perhaps more than Adam, but maybe you as well, Adam. At this point, the school district is apparently surveying parents about their feelings about going into a 2-day week in school for K through 12. They have some concerns that this seems contradictory at a time when cases are in fact increasing. Charlie, do you have a sense of that?
So we've got a team that works really closely with all of our schools, as well as with the Oregon Department of Education. It does seem a little contradictory on the face of it, but at the same time, we have been watching epidemiological data from around the country and around the world where people have been doing natural experiments. There have been places that had very, very little in the way of restrictions, particularly around education. And some of those, not all of them, but in some places, those show that schools are a pretty controlled environment. And when done carefully and done well with precautions, there are places where schools have operated in the face of pretty widespread community transmission without adding a large amount to the overall burden of disease, or particularly been focuses of transmission. But again, that has to be on a case-by-case basis. We really, it is up to each school. Different models work, different ages work in different places. I think we've been very conservative about this and not taking chances with these lives or any others. I think that cautious approach is still warranted. And just like with the vaccine, I think people need to be involved and be part of the decision making on this, knowing that on the other hand, as Danielle can well attest, the social and psychological effects of ongoing isolation for young learners and
Which leads to another question that has come in.
Yeah, I mean, these
we'll
are
go
serious
there.
problems.
We'll go there in a second, but I want to see if Adam has anything to add so far.
Yeah, I agree with Charlie that there's a lot of, adverse effects from keeping children out of school, not only learning, but socialization as well. And, if we don't have data that show schools are contributing to ongoing spread, I feel like as a state and as a society, we need to be focusing on education and seeing how we can insulate and how we can make that work in the community, because that is important. And I think it should be a priority. Nothing is without risk either, but we need to prioritize those parts of society that are really essential.
And I think this question is asked in context of the community health is important, but is there not a balance to be struck in terms of, as this person sees it, there's three priorities to be balanced, which is the economy, health, and education. From your standpoint, how are you feeling in terms of what is your sense of where our community is at and balancing those things? Is there something you'd suggest to be done differently?
I think the current guidance around very limited and cautious access in elementary education is appropriate. I think there's a big difference between older people who read to learn and the very young who maybe don't do so well in an isolated environment on screen because they are just learning to read. And they need those social interactions. I would seriously caution against taking it one step too far and blowing the doors open just because it works in a smaller, very controlled environment doesn't mean that there aren't overbalancing risks. If you just say, if it's good for very young and small schools and small groups of students, it must be safe for everyone. I don't think that follows.
Gotcha. And then Danielle, what would you add to this conversation in terms of that social balance of health and then education and the economy?
Yeah, I think it's important that every family look individually at the family's needs to determine what's right for their family. Just because school is back in session doesn't mean it's right for all kids to be back in school. I think the challenge right now is that, we're expecting kids to be able to sit in front of a computer for several hours a day and learn, when I think everybody that's on the screen right now can say we do the same thing, and at the end of the day, we're done with looking at a computer screen. So expecting that from a child is unrealistic, and expecting that to be a positive learning environment is unrealistic. I think the other challenge that we're facing with this is parents who aren't teachers and having to learn to navigate that teaching environment with their youth, with their kids. And the challenges that just comes with inherently, because, we have parents that are trying to balance kids being at home and working from home and all of these other stressors, and people aren't managing that well. So I think it really should be an individual decision based on the needs of the family, and not just a general, everybody needs to do this decision.
Okay, and then, I guess the next place that we want to go is another question that's completely unrelated. I think we've kind of wrapped this up, but does anybody else have anything to add to this? Because this seemed an important thing to ask. We're good? Okay, good. And actually, I will move to Charlie on this one because I really think this is really your wheelhouse. Benton County, in terms of tracing, contact tracing, questioner is specifically interested in, are we going to be starting to up the use of our technology locally? Apparently, I think the feeling may be that there's more technology in use elsewhere on the planet, and why not here? And are there any plans to increase our use of technology for contact tracing?
So they may be referring to these phone apps that once you have a positive test, you can log into, and it's got some proximity cues that can help you individually keep your distance from one another, and other people know in a de-identified way if they've come near someone who is a recent record of having been vaccinated. These are really complicated technologies. There's a lot of privacy issues behind them. Oregon State University is in discussions with the Oregon Health Authority about piloting use of some of those on campus. We've been working closely with OSU Athletics, Dr. Brady and myself and a number of others, and with University of Oregon. And there's some technology that they may be applying that's actually a proximity monitor to help their athletes and their student athletes keep a distance from one another. And you just wear this thing and it beeps at you if you're within 6 or 8 feet of another one. They're like I say, there's a lot of hurdles with this. There's a tremendous amount of privacy issues. I think a lot of people would be cautious about opting in and using some of this, but we are looking into it. And like everything else around COVID-19, there's a growing evidence base and growing literature, both positive and negative, about a lot of these technologies.
Great, and I'd like to move to Danielle for the next question. From a mental health perspective, what might be some of the longer term effects from the current isolation? And they're asking separately for adults and for children. What might some of those anticipated effects be long term?
I think longer term, you're looking at increased depression, increased anxiety in adults. I think the risk with children is much bigger because children need to learn how to socialize appropriately with other individuals. And if we're isolating them from being able to do that, that has a larger, longer term impact on all kinds of social skills that could have lifelong implications. So, depending on the age of the child, if it's a smaller child, there's more risk to that because they just haven't had the same interaction abilities that an older child would have. But there's huge implications to the social distancing and social isolation that these kids are experiencing. I think there's risk of kids not knowing how to interact and play with each other, not knowing how to share, not knowing how to talk to each other. I think we've lost some of that anyways with phones and a lot of the technology that people were using pre-COVID. But now that we've intentionally isolated kids during COVID, I think that's just increasing tenfold. And the long-term implications of that are really, really concerning from a mental health perspective. Are we creating kids that don't have any coping skills or any self-management skills, any anger management skills, because they've never had to deal with another or have limited need to deal with other people? And what's going to be the outcome of that? I don't think we know, but I do think there is significant concern from the mental health perspective about that.
Thank you, Danielle. Really appreciate the answer. And then I guess I'm going to go ahead. I'm going to move over to Adam real quickly. And I'm going to ask for these questions to kind of get answered about a minute or less because we're kind of coming towards the end of time, and we'll be moving to Dan Rayfield, Representative Dan Rayfield. Adam, does Sam Health have at this point enough PPE? And if there were a surge at the hospital here in Corvallis specifically, do you have the ability to reach out and get enough PPE and enough beds online if there were a sudden surge?
Yeah, I am confident in our ability to provide the adequate PPE to our staff to get through a surge. And throughout the summer when we weren't seeing very many cases, this was a big point of emphasis as far as building up supplies of masks and gowns. And we were actually, with the help of the Samaritan Foundation, able to purchase hundreds of PAPRs, or portable air purifying respirators, like those hood things that you can wear and are reusable. And so we feel very good about our ability, and we're rolling those out as we speak. We feel good about our ability to withstand a surge as it pertains to respiratory protection.
Great. And then Charlie, and this questioner is asking point blank, if we continue to see the current rate of transmission growth, are we headed to another shutdown?
Boy, I hope not. I think we know what works. We were able to keep this under control for a long time, but we sort of patted ourselves on the back because there wasn't that, compared to what's happening now, not that much virus out there. So when we took chances, when we got together with people, we were sort of flipping a two-headed coin and patting ourselves on the back and congratulating ourselves when it kept coming up heads. There's a lot more virus out there. We are, now there's a lot more chances of it coming up tails and turning into a problem. Shutdown is the last thing we need. And I think it's up to us to avoid that. I think, all of us cringe at the thought of an imposed shutdown, and we're the ones who can prevent that.
Demographically, aren't we really looking at most of that growth is in what age groups and demography? What's going on there?
Well, in Benton County, over half of our cases are in the 19 to 29-year-old age group. That's a bit younger than the rest of the state. The rest of the state, the greatest prevalence is in 30 to 40-year-olds. But in both cases, what we're seeing are these small group social gatherings that are the driver.
Like a house or something.
You bet. You bet. So, the recommendation that's being made in Utah and was made by the governor for right now, stick to your household members and, watch your sports events yourself. It's hard. It's hard for all of us. It's boring. It's depressing, but the alternative is not good.
Sure. And then, I'm going to go ahead and ask some final questions, but first one will be for Danielle. Yeah. Okay. All of us at times are getting impatient with this whole pandemic thing. We'd sure like to be able to get out there and do stuff with people, get into new groups and go exploring around with folks that we don't know. Meetup is an awesome site, but right now can't do that. Mm-hmm. For somebody in that position that's accustomed to being able to go and meet with people personally and just normal human gregarity, what are some hints to just kind of have people get through this until really next summer is what we're hearing?
Yeah, I think when the weather allows, having those kinds of interactions outdoors would be something they could do with, of course, face coverings and appropriate physical distancing. I think as difficult as Zoom calls are or FaceTime calls, I think that's an alternative. I don't think that's 100% the same thing, and I completely recognize that, but I think that's the option that we have. I think having in-person contact for right now is pretty challenging, and there's a pretty substantial risk that comes with that. So, I would discourage that. For me, it's the risk versus benefit is the benefit
when you get to a point where you're impatient with the whole
Mm-hmm.
thing, what do you do for yourself to kind of get yourself through the day?
I call and talk to my best friend.
Okay.
Yeah.
There we go. And then I've got a sister that's willing to talk my ear off. Adam, from your standpoint, I guess my last question for you is, you're an infectious disease specialist. That's what you do, Doc. What are your few pieces of advice, just keeping it simple for folks in terms of staying healthy?
The same things that Charlie has mentioned. For one, take care of yourself as much as you can. Again, we've been talking about mental health a lot, and eating right, avoiding excessive amounts of alcohol, trying to exercise as much as possible. That's going to help your mental health altogether. And then it's really just staying safe. Really, cases are skyrocketing all over Oregon, and so this is not the time to have that dinner party or the get together. And if it happens, make sure it's outside, make sure you're wearing masks. Again, really try to stick to your family unit, your household, because that's really going to help stop the spread. Again, you almost have to act nowadays that anyone that you meet potentially outside of your house could have COVID and not even know it. Okay, so that's why the masks are important, and that's why it's not worth taking chances outside of your household, at least until things start dying down and we hopefully get a vaccine.
Great. Charlie, any parting words?
I think the only thing I would say is, we talk about numbers, we read about numbers every day. I'd really like people to remember that these are individuals. Every single number represents a person. The almost 250,000 deaths that the U.S. has faced, these are all individuals that were someone's children, were someone's parents, were loved and cherished, and will be missed forever. And that, to me, really reinforces the need to be cautious, and not just, be cautious that someone else might give it to you, but that you may be carrying it, be unaware of that, and give it to someone else who is less robust than you, and may end up as another tragedy that we don't need.
Well, thank you, Charlie and Danielle and Dr. Brady. I'm assuming we will be back here in a few months checking in yet again. I think this is, for some of you, the third or fourth time. We appreciate you and all of the work that you were doing. And I will now move, and of course, spending the evening with us, because your schedules have to be challenging at this point. I want to go ahead and say thank you, and I will move back to Kara.
Thanks, Steve, and thank you to all of our local experts. Next, we have Representative Dan Rayfield here to give us a review of what has happened in the legislature this past year and a preview of what to expect in 2021. Welcome, Representative Rayfield, and congratulations on winning your fourth term.
Thank you.
Yep. And then our first question to you is, could you bring our viewers up to speed on what's happened so far this year in the state legislature?
Absolutely. And I think maybe what it would be is to take a step back to 2019 as well and walk us through what has been, quite frankly, a very up and down legislative cycle, if you will, and also to let folks know kind of my role in the legislature. You have folks that are, might be stuck in certain policy areas on certain committees. Other folks are in leadership. We all kind of have different roles in the legislature. Where I fit into that ecosystem is I co-chair the Joint Ways and Means Committee in Oregon, which is the committee that sets all the budgets for the agencies. Policies that have money that need to be tied to them come down to Ways and Means, and so that's primarily the space that I operate within. And obviously, you have your own personal policies and things like that, but that's the committee that I chair. And so, as I talk about things, you'll see what I'm talking about a little bit from that lens. Whereas if you talk to, say, Senator Gelser, it's more policy oriented. So, just kind of to give a little context. When we came into the 2019 session, it was the budget was in a fairly decent shape. We were looking at moving through a very complicated 6-month session where we passed some pretty, what I would say, forward-thinking policies, what we call the Student Success Act, which made about a $2 billion investment into K through 12 education. You had some other pretty significant policies that were done, paid family medical leave and things like that, in a very interesting session where we had the minority party in Oregon that walked out of the session at times because they didn't like some of the bills that were being brought forth by the majority party, and that was a way for them to stop those bills. But we ended up getting through that session fairly successfully. And the sessions are 6 months long. As we wound our way into 2020, we had left Oregon's budget with actually a 2% ending fund balance on top of our reserves, which were going to be projected to be about $1.8 billion. In fact, Oregon, and this is kind of important from where we are right now, Oregon was in one of the healthiest positions out of any of the 50 states to weather a significant recession based upon the way that we had planned. Normally, in a 2-year cycle, we only add an additional 1% of our ending fund balance. And you think about $240 million, if you will, of general fund taxes that get set aside just in case for emergencies, things like that, on top of the 1.8 billion. When we walk into 2020, we had a big growth of revenue. Just remember, the economy was churning along at that point. And at that point, we had gone from having this roughly about a $470 million ending fund balance to having about a 1.2 billion ending fund balance. And you can imagine when you go into a legislative session, how people start looking at that saying, hey, finally, we can start making traction on some of these new policies or whatever it is that the direction the legislature wants to move towards. In that session, some of you may remember, that is where we started to hear about the pandemic. Right? It was really kind of a distant thought. It wasn't really anything that we were making active decisions on. At the end of the legislative session, which is a month long, so think the end of February, we ended up, the Republicans had walked out over, and the minority party in Oregon had walked out over the potential that climate change legislation was going to pass the legislature. And for the folks that walked out, they believed that this legislation was an existential threat to their communities, while you have the folks proposing it or moving forward with it who believe that climate change is an existential threat. So it's sometimes very challenging to meet in the middle under those circumstances. They had left right as we get out of that session, the pandemic hits. At that point, things become very interesting. Within a week of that session, tensions are very high, right? As the folks who want to pass this legislation and people that walk out, there's a lot of emotion and feeling, why the heck did you abandon your job? Right? Why did you do this? On the other side, the other folks are saying, you're not listening to us. This is going to be catastrophic for our communities. And the tensions are high on their side. Within a week, we had to come back together for what we call our emergency board, which is a pot of money that is set aside by the legislature into a board that then is able to give money out. In typical years, it would have been on forest fires. It would have been on Salem had water emergencies. And so in that situation, we started beginning to front load some costs for what at the time we didn't even really understand the true extent of the pandemic. And there was a lot of questions about, is this going to be enough? And we were using our agency's best guesses of what they thought was the appropriate amount at that time, which, now in hindsight, we look back and say, boy, that was nowhere near the type of resources we were going to need and would actually have to allocate for that. Within the next couple of months, as you start working through April, May, and June, in the budgetary world, in my world, we were really focused on revenue. And we continued to get briefings with the governor and showing that, hey, there's going to be some significant revenue declines, potentially in the short term of, where we might have to shore up a $1 billion to $2 billion shortfall in the current biennium. And in the next biennium, we might be short about $4.5 billion. And in the context of Oregon's budget, right? I mean, that's a 15 to 10% or 15 to 20% decrease in general fund revenue in the next biennium, right? So, I mean, this is pretty significant. And during that period of time, There's a lot of, the governor was talking about making broad cuts across all agencies. There's a lot of negotiation about saying, should we have a special session to deal with the budget? And there were differences of opinions on that. The legislature firmly believed we needed to come in and be strategic on how we made reductions in the current biennia. How much reserves should you use in a shortfall scenario? And the first new forecast comes out in May. And in that May, it was what I would say a very catastrophic and eye-opening revenue forecast, which put us down about $1.2 billion for the current biennium that we're in now, that will end next June. And we also get projections for the next biennium, which was going to put us down roughly about $4 to $4.5 billion. So a lot of the conversation then turned into, how are we going to hold a public process in a pandemic about significant reductions to manage not only the state's budget in the current biennia, but then also set us up for success into the next biennia. And the process was equally as important as, to make sure that people were involved and then to actually hold the reductions and actually pass a budget, which is, as you can imagine, probably extremely challenging when we're all socially distanced under these circumstances. We went through a public process where we started, what I will tell you, it's normally you'd be focused on campaigns, or you have your one short session, and we're kind of in theory, we're a part-time legislature in the role that I serve, and it's not so much that. But we was, constant 6 to 7 hour meetings, going through line items of every agency in the state of Oregon, where we would look down. I mean, you may not think of that, as legislators, we look at things as low as, I think it was $10,000. We're looking at travel budgets in very small agencies. It was no stone unturned, trying to find reductions that would have the least amount of impact, also with an eye on not exacerbating what we knew was going to be a recession. In past recessions, people have made cuts, and that has only made a recession worse and didn't allow us to rebound out of the session as quickly as we wanted. And so being very cognizant of that, also having the reserves and going through negotiations with the Senate, the governor, and the House as we tried to figure out where is that sweet spot on the right amount of reserves, the right amount of reductions to be able to get this budget passed through. Right as we had gone through this public process, we've kind of set out our forecast. We have the votes in the House and the Senate. We got a new revenue we passed that budget, and then we get a new revenue forecast, which is actually better. We kind of whiplashed back and forth. Where now what we found out, and this is the really key takeaway that we need to remember, and I say this again, the really key takeaway from this is that the revenue forecast wasn't as bad as it was, but why? And why is the really critical component is that our economy, and you'll hear a lot of people say that the economy is broken in the way that it is designed and who it benefits. Really what happened is the revenue didn't get hit as much because the people who are not being served by economy are the ones that are being impacted, and it wasn't having a monetary impact on our revenue forecast because of the way that the revenue comes into the state of Oregon, with more wealthier people benefiting. And we're still paying taxes because they were not necessarily being impacted by the pandemic, right? So it really shined a light or magnified some of the existing problems and of the imbalances of wealth inequality in our society. And so keeping that in mind, we were able to keep the reductions in place to then set us up for the next biennia, where now we're again projected to be short, and I say only about $1.5 to $2 billion in the upcoming session. Which will start in January. To think about that and what does that mean, right, for all of us? When you think about K through 12, if you have kids in school, you're thinking about your student to teacher ratios, thinking about are the schools going to have the resources, thinking about your Public University Support Fund? Are we going to be able to adequately support our colleges and community colleges? Will we be able to fully fund our Medicaid program in Oregon? These are like the big ticket items. There's a whole bunch of smaller ticket items that a lot of us would say, boy, that's really important. As we look at it, whether it's environmental protections, or what do we say, our child welfare agency, right? Which we always see the headlines. We need to continue to make traction on that. So we have to solve for this budget shortfall. On top of that, what we need to do is then there will be increased expenditures to maintain the same level of service. So think about we're going to have increased testing in Oregon, right? And for COVID, that costs money. Some of that will be carried by the federal government. Some of that's going to be on the state burden. That's a new cost. Think about higher education, that is other fund revenue streams. They're not as high as they used to be. And so do we need to compensate on a one-time basis so that they can get through this tough period in time? So there's going to be this separate component of things that we'll have to do on top of shoring up the budget. And then you need to make critical investments into our economy. Think about our wildfires and folks that have been impacted by wildfires. Think about our behavioral health crisis in Oregon. Housing is not a problem that is going away, and that's going to need to be tackled in this next session. So in the next session, you're going to really see a lot of emphasis, on the budget, making sure that it's taken care of in a way that doesn't make the recession worse, shoring up some of the new needs that are on a temporary one-time basis, right? And then also, how do you keep moving the needle? We can't march in place on issues like housing and behavioral health. So that was really long, Kara, but I wanted to give a long, and then maybe you and Steve can, we can break into if there's areas that we want to dig into. I probably put everybody to sleep though.
That's okay. Thank you so much for all that information.
Yeah.
So you kind of touched on this, but in your view, what specifically is coming up for state lawmakers for the year of 2021?
It is, and that really is focused. There's going to be this, and I talked a lot about the budgetary side of things, right? And that is, there's some interesting decisions that have to be made. There's a lot of things outside of our control, right? What we talk about, is there going to be a federal stimulus package? Where does that go? The CARES Act dollars, it may just seem like, on the outside that, boy, there's this money that just comes into the state. We then have to figure out how it comes in, what you can use it for. And it took months to figure this out. We have now finally have reports of revenue streams coming to agencies that we didn't know were coming in, right? And we need to figure these things out and really, what is the baseline for those? So there's going to be a lot of work there. We have what we call our FMAP, or our Medicaid match rate, for every dollar that we spend on our Medicaid program. There's been an enhanced match rate. We need to figure if that's going to be extended longer because of the COVID emergency, which I assume it will, but if it does, that helps, part of this picture. Figuring out how much reserves do we want to use to balance the budget. We used about $400 million of reserves. That leaves us with about, roughly around $1.2 billion for the state of Oregon moving forward. Now, on top of all of this, right, if we are going to move the needle on whether it's behavioral health or housing, we have to figure out how we're going to do that. And so you'll have policy committees. Frankly, I think some of those bigger ticket items are going to be behavioral health. I think it will be housing, again, having a comprehensive housing package. And then, there's a possibility, there's work groups right out there right now looking at a public option for Oregon and what would that look like. And on top of that, you have, the racial injustice movement, and there is a lot of traction to continue what we've been doing in Oregon on those issues. So those are, and all of that will be happening independently while we're all kind of working on that. All of this, we still haven't figured out exactly how are we going to operate, right? Is this going to be in, on a Zoom type environment, distanced? How do you, on a floor session, maintaining social distancing where all of us can't be on a floor at the same time? How do you pass the same number of bills in a session when it takes, twice, 3 times as long to pass even a simple unanimous bill? So there's other functionality, procedural issues that we're going to have to figure out moving forward. How do we have adequate access for people in the building, or to engage in the system to talk about what they would like to see in these bills changed, or to advocate for or against whatever that looks like. So there's a lot of other things that we're still in the process of working out too.
Thank you. And then, do you have any guesses about how the years after 2021 will be impacted by the pandemic with the legislature?
I always joke that when we became legislators, they never gave us crystal balls. It would be super helpful had they done that. What we try and do is, at least in a budgetary sense, or is really look into a 10-year frame of mind as best you can when we're trying to make investments in where things look. The pandemic has obviously really challenged us in our ability to project out and what things look like. The best guess when this all started and has been going on, that it was going to be a 3-year impact for the state. But I got to stress this again, is that the impact is always talked about in monetary impacts. It's not talked about in human impacts for people that are impacted by this. And how does someone who has lost their job, who's been left behind, by our economy, catch back up? Right, where everybody else is, or not everyone, but a significant chunk of our population continues to march forward. Those are real challenges that while numbers-wise we may recover, the impact to Oregonians, I think we need to take a deeper analysis on what does that really look like. And I don't have a good answer for that. It's just something that deeply troubles me as we think about. We always think about, it's the revenue, or revenue is good, that means we're doing good. That's not really true. So that's something that, whether it's Corvallis or Portland, we have a monstrous housing crisis, and that didn't change the fact that we had record revenues, projected record revenues last February without a pandemic. So there's a lot of work to be done.
Thank you. And thank you for answering our editorial board questions. We'll now move on to audience questions. Steve?
Thank you, Kara. Representative Rayfield, been a while. Hi.
Good to see you.
Yeah. Okay. So let's get to audience questions. And, we've got one that really came up kind of immediately today, and then I'll move to some of the ones we had prior. Apparently today, Steve Trout, State Director of Elections, sent an email. I resigned as of today. He's, I guess, gone, or shortly. I don't know what the timing is. Anyhow, Steve Trout, Director of Elections, has resigned, apparently feeling as though things could be handled differently in terms of elections through the Secretary of State's office. What do you know, and what's your view of it?
Yeah. Well, Steve, this, I'm kind of the person who believes that elections is kind of the foundation of a democracy. And so I have a lot of, I think, passionate thoughts about how we can always improve the system. And so I've worked with Steve quite a bit throughout the years, and maybe annoyed him over the years also might be, with ideas and thoughts. I will say that in my personal opinion, Steve is extremely bright. And he's had some, challenges with folks in the past, and, he'd moved in and out of the Secretary of State's office, but we always need to remember that it was a part of his work that led to Motor Voter here in Oregon, which then spread across the nation. And so I read through some of the issues that he talked about, and I've actually had some conversations with him privately as well. And I think some of the concerns are very valid, frankly, in terms of it's really challenging to have an agency where your executive director or your agency head, right? And the Secretary of State's office is glamorous in a political way because it has cachet and a name title, but really you're an agency head. You're an executive of an agency. And when that continues to turn over throughout the years, right? And there's no fault of, and I think Director Trout mentioned this. It's no fault of, Dennis Richardson, passed away. You had Governor Brown, who got appointed, and you had, at that point, you had a temporary placeholder for a couple of years. Then you had Dennis Richardson. Then you have another appointee, and now we're getting a new Secretary of State. We don't think about that, but that has an impact on the direction of that agency. And in the legislature, I would see different ways that they might approach a given issue. And so I think it's really, great that we will finally go back to an elected individual who, may or may not serve the full 8 years, but we'll start to see a positive direction. They have some really technology issues that aren't going to affect the what I would say the integrity of elections right now, but there are things that we absolutely need to work on long term. And frankly, there's a lot of opportunities if we think about how do we have a better experience for voters, right? To engage, to know more about candidates, to get money out of politics. There's just that is an agency that is ripe with opportunity, and so I think it's a shame that he was let go. But I can't speak to the circumstances of why, but I also like the fact that he wrote the new incoming potential Secretary of States too. So
right, both of them, right?
Yeah.
Before the election, yeah. And then to be clear, you feel that the current technology issues do affect or do not affect the integrity of elections?
Do not.
Okay.
Currently in Oregon. So I
don't know. You spoke quickly, and I wasn't sure if I caught it correctly. I want to make sure audience catches it correctly. Great. Okay, let me move to the next question. This one has to do with the vaccination bill that apparently passed the House last year. Yes, this year or last? I don't remember. But then it got pulled in the Senate. And any chance, and what this bill was geared towards childhood vaccinations, removing philosophic and religious objections and allowing only medical rationale in terms of an exception for childhood vaccination. Any chance that's going to be resurrected in this next session?
Really good question. And for those that aren't familiar with how contentious this was, there's very passionate folks who are opposed to that were very opposed to this law that we passed 4 out of the House. And for those watching, I voted in favor of this. It moved over to the Senate and died. There were issues with the way that someone could get a medical exemption. There were, like you say, philosophical objections, and it was frankly one of the more contentious bills that we dealt with in 2019, and it was killed by one of the walkouts, where the minority party left and said, hey, this bill can't move, and if it doesn't, we'll come back to the building. And so that deal occurred in that process. There were people that were very interested in bringing it back to the upcoming legislature. The interesting dynamic right now, though, Steve, is you have you had this plan of where things might head in terms of an agenda or a legislative topic in this upcoming session. Now we have layered on the pandemic, and we've also layered on wildfire, and along with the existing crises that we do have in Oregon. And so I am curious to see whether this will be brought back. Myself, I have not heard specifically, since some of these new events have come up. Often during this summer, right, we'd be engaging, we'd be talking about new policy ideas, where a lot of our space as legislators was reacting and to the emergencies and things that were going on throughout the state. So it has been a very strange, by necessity, summer as we lead up to the next session. So I don't have a good word on whether it was. I just know in the past people were planning on it.
And then you kind of unintentionally segued into another questioner's question, which I will go directly here. And the walkouts. The question is there nothing that can be done to prevent the minority party from walking out? And do you think that given the success of that, tactic, we're going to see more of it. At this point, you maintain a supermajority as a party, but you're not a quorum unto yourself at this point. And understandably, I think the question is, are we going to see more of this?
So I think the unfortunate answer to the question is yes, as long as this remains a tactic. It is. I think it is always on the table. And there's a couple things that we have seen, and just so people understand the history, when we all decided as voters to pass annual sessions, we put constitutional deadlines on those sessions. Those constitutional deadlines created what I would say, there is a schedule in the building where it creates a time crunch and a procedural advantage if you can delay business. And some of the delaying you heard, at first it started off with the minority party reading the text of the bills, right? And so we'd sit for hours on the floor reading a 90-page bill when the 90 pages was context and only 4 of the pages actually had any changes to it. And we'd sit there and we'd read those bills. But what it does is it backloads the work of the legislature to where when you get backed up against that constitutional deadline, you cannot complete your work. And so walking out is another more dramatic way to create that backlog, where if you come back on the last day or the last 2 days, the minority party at that point has complete discretion on what bills to kill and what bills to let go, because they have to suspend the rules. And their votes are needed to suspend the rules to advance the business. And that has only become relevant now that we have these constitutional deadlines. And in all transparency, I mean, the Democrats had done similar things when we didn't have constitutional deadlines with redistricting. Okay, and some of you might remember the Democrats walking out under those circumstances because there was a deadline for redistricting when it would go to the Secretary of State. So similar games have been played. And so we have to figure out either a way to come together as elected representatives and build confidence within our body to not do that, or B, we have to find other mechanisms to curtail the ability of any minority party. And it will be the Democrats in the future at some point, right? To curtail that, where the point of the election is a governing group of individuals is elected based upon their platform, right? And you shouldn't give, in this case, 20 members out of 60 a foolproof veto on any legislation, that it moves through the legislature. That should rest within the governor's office. So,
okay, and then in discussing all of this, we've discussed the wildfires a few times. Is there any legislation coming up in terms of wildfire prevention and suppression? I know that some of that stuff was supposed to happen, didn't happen because of the walkouts.
I know.
What's going to happen this upcoming term, hopefully?
So that is the good news, right? Where we do have some things queued up with respect to defensible space, with respect to air quality and other things that we have been working on in the short session, like you pointed out, Steve, that unfortunately wasn't able to pass because of the walkout. I anticipate that those policies come back. I think you will then see, and also there was a couple of proposals in there where you have environmental groups that are able to work with the actual forest management folks to selectively go through and actually manage forests in a way in which that everyone agrees to. And so there's some really optimism in some of those spaces. On top of that, I think you're going to see there's going to absolutely have to be there is a fund a wildfire fund that we were looking at that needed to be revamped and is ineffective, frankly, for what we're dealing with right now, to help folks that don't have insurance, right, and that have lost everything. And the way that it is currently designed is minimally helpful, and so I assistance the folks who need it the most, and that obviously is going to take front and center while we then work on the prevention side.
And then all this discussion, I'm assuming that we're looking at some revenue shortfalls these next few years. Are there good projections in terms of quality projections from the standpoint of really knowing what those shortfalls may be, and what's being discussed at this point to address them?
Yeah, so I always, I serve with Senate co-chairs of Ways and Means, and we all have our unique personalities. I generally am the optimist in the room and how we solve problems. We tease each other about this. So when I look at the shortfall coming into the next biennium being about 1.5 to $2 billion, what it is you chip away at any problem. Right? You don't want to get overwhelmed at the big number. And you start looking at, we just passed a tobacco tax, right? That is going to help us free up some general fund to the tune of about $400 million as we look at this. You start thinking out, okay, we have, $1.2 billion in reserves. Right? We're not going to want to use all of that, but we have that as a tool at our disposal. We just made some reductions to balance our current budget. Those cuts that we made in a 1-year space, if we made a cut of $1 in the last year of a biennium, that's going to equal $2 of savings in the next biennium because it's a 2-year savings. And so there are things that what we call in the budgetary roll up into the next biennium. So we'll have some savings there. We talked a little bit about the FMAP or Medicaid match rate. If that extends on into the next biennia, that is something that will help tremendously in the budget. If there is a stimulus package, even the most conservative Republican stimulus package would have provided some assistance to our K through 12 schools, which is going to be desperately needed as we hopefully try to start back up next year at some point. And so that will help ease the burden. So as you start chipping away at all of these things, you really start to see how we can get to about $1.5 billion over that period of time. And so those are the things that are initially being talked. The real question is, how far do we need to go, like we were talking about, for increased testing, wildfire assistance? What is the proactive housing package that we're going to need? What are other local economic stimulus packages that we feel are necessary to pass? We desperately need to continue our investment into behavioral health, and so those issues, they all start to crop up, and at some point we will be limited by resources and what we're able to do. Right. But there are also some existing programs that have not started that we could continue to delay, right? That are not detrimental to the essential services that the state of Oregon provides.
So in other words, really a multi-pronged approach is what you're really saying is going to have to be taken here. So that pain is going to be distributed.
Yes. Absolutely. And the hope is you make it as least painful as possible. That's the goal. Right.
Yeah. Okay. And yeah, we've talked before, so I know that I know that you will take a nuanced approach. I saw that was what would happen with PERS a session or two back, where it seemed to be a nuanced approach.
Yeah.
Okay. And then I guess the next question kind of follows up a little bit with what you've said. There apparently will be a change in administration, federal administration, in January. What is the meaning for the state, and what is the meaning for Oregon directly in terms of budget, I would imagine, and perhaps in terms of flexibility, in terms of ACA and Medicaid and Medicare?
So you hit the nail on the head with both of those, frankly. That's when my mind thinks of the administration and where do we head. I think sometimes I don't think there's a lot of administrative things that go on that we don't realize how big of an impact that plays in our world, whether it's environmental regulations or frankly how the administration will handle Medicaid waivers, right? Which allows, and for those that don't know, the Medicaid waiver that we have, that is what allows us to have global budgets in Oregon, which has allowed us to experiment with CCOs, which have been wildly successful. And so those are these really important features that an administration, and marks that an administration can leave, on small states like ourselves. So the first one is having an administration and a different viewpoint on a federal assistance package, right? That's going to go out to the various states. Red or blue states right now are hurting. We are very fortunate to be in the economic condition that we are in. Many states are not, and so I think having that administration and that approach is going to be extremely helpful for us, dealing with the COVID crisis. And I know that this is it's a political issue, but having an administration that takes it seriously, and demonstrates leadership on how to move forward through a pandemic, as opposed to kind of throwing caution to the wind, is my editorial on that. I think is going to be a huge help as we navigate through this next year, financially, but also just for I think bringing people together to tackle a humongous challenge. The other side of that then is I think the biggest opportunity is going to be in healthcare, which is our Medicaid waiver. There are ways where we look at social determinants of health. And think about housing. And the way that we look at our Medicaid dollars, we know that investing in housing is something that can, over time, potentially lower the costs of the healthcare that we deliver. Right now, you can't, in a global budgeting setting that we're currently in under the current waiver, we're not able to, to simplify it, we're not able to get credit for money spent on things like that. I think that there is a real opportunity to start incorporating social determinants of health into our Medicaid waiver in a way. And this is it's not like it's Dan's idea. These are smart individuals, CCOs, folks in the governor's office that have all come together starting to look at how do we take that next step with healthcare to lower the growth of healthcare costs, but also provide better quality. And social determinants of health and global budgeting is a real big opportunity under a new administration that really wants to move down the road on healthcare, right? And so that's something for me personally that's very exciting.
Yeah, and bringing that all back to ground level, I was talking with one of our panelists that we'll be having next week. And we were talking about this report that's getting generated now for early next year, and the ability for Samaritan's IHN to work, which is the CCO here, to work hand in glove with the county comes from some of that.
Yeah.
And we're starting to see better intervention, earlier intervention, and better outcome in the homeless community locally here in Corvallis, because that starts out with a federal administration and decision, filters down to what the state does, and then that winds up with what the county is doing and the city has in terms of outcome. So it's making a difference in individual lives. And there's a report that's actually coming out to indicate what's going on in terms of numbers here locally. So that was interesting. Okay, and this question we could of course anticipate. What is your view in terms of the state's COVID response in terms of balance between the priorities, as this questioner sees it, of health, economy, and education?
I have, when you're in these roles, you always wonder, how would I have handled that? Right. And you think about it, and I sit in rooms where we talk about some of those things. And the governor, it's interesting because, when I deal with the governor's office, mostly it's on budgetary issues. It's not on, what are the guidelines that are going to be put forth, and how the governor handles, whether they are closures or, and the different metrics. And I do not envy the governor, frankly, having to go through this and walk into this space and try and manage all these things. I think she has done, frankly, a pretty remarkable job if you look at outcomes in the state of Oregon. And I think that's how you have to measure it. When you're in those rooms with the complicated decisions it is not weighing that initial decision to shut down the state of Oregon. That was one of the most heaviest decisions that any elected official ever will have to make, because what the consequences are economically in doing that. It's not like that is done, just willy-nilly. It is a big decision where you're wearing public health consequences, seeing what's going on in other states. And I think it was a really a challenging thing to do. And so I have immense respect for the way that was handled. Of course, I'm sure if every one of us was in the governor's shoes, we probably would have done things a little bit differently here. In hindsight, as you look back at how we've been able to manage some of the things that have been done, specifically for me, it comes back to the unemployment department and how we were able, and the challenges that went on there. I think the management within that agency, was something that if you were to go back in time, you'd do differently, right? And that had a dramatic impact on people that were impacted, by COVID. And so overall, and you look at outcomes of where our economy is, our health outcomes. Unfortunately, we're obviously, we all know, we're trending in the wrong direction at the current moment in a way that was very predictable. And so I think the governor is going to be forced to be in a really rough decision spot again, and continues to warn us on a day-to-day basis. Hey, please wear a mask. Please be cautious, as we are starting continually hitting these historic numbers. So overall, I'll gauge it on the metrics, and how difficult that job was.
Comparatively, and I forget who I was speaking to, and I don't know if you have the number, but I know last week I was talking with, I forget which public health official, but we're doing sixth best in the country, aren't we?
Yeah, really well.
So in terms of transmission, frankly, fatality, so forth, caseload.
And it's nuanced, right? So if you're in Coos Bay versus in Portland, I think that's the really interesting thing, that the way the governor has handled this. And it's not like it's the governor who comes up with all these ideas, right? She has competent, qualified professionals, that come in and advise on different strategies for this. But, we have a family member is a teacher in Coos Bay, right? You have my mother who lives in Portland. We're in, Corvallis, Benton County. It is a vastly different feel for each one of those families and the environment that they're in. And frankly, the communities that they're in too. And so it's been a nuanced approach trying to cater towards the given circumstances in each county.
Now, one of the things that you do here, and this will probably be, I wasn't really even going to ask this, but I guess I will. I was going to kind of let it go at that. One of the things that you do here as a criticism is that the governor will change her mind at times or evolve her thinking. There are some people that take that as positive and other folks will take that as a negative. But I've seen, even from the standpoint of news coverage, where a report will come out where somebody will advocate for a different way of doing something, and the governor will respond to that with some changed policy. Positive or negative in your viewpoint?
So you could probably guess, Steve, with my level of optimism. And I know in a political world, especially in a polarized political world, we like to attack people for changing their minds. That's the feel good gotcha thing that we like to do in this political world. Democrats do it just as much as Republicans, and so I don't want to say that it's anyone more than another. But you see the mailers every political cycle. I personally think that over time we're going, with new information, that we should change our minds if the information warrants that we do so. And I think that's the right way to lead, and then to be transparent about that, about why those changes are made. Right? We're not perfect. We're human beings. Doesn't matter who we are, and we're always in a constant state of learning. Just look at the way that we've handled criminal justice over the last 3 decades. right? Especially juvenile criminal justice and what we have learned, over those years, and what is the best way for us to handle that. And the thoughts that we had in the late 80s and 90s is vastly different than the way we handle it now, and it gets better outcomes. And so if we sat there and we're dogmatic about sticking to something that doesn't work, that's not good for anyone.
Representative Dan Rayfield, as always, I appreciate your willingness to appear and answer these kinds of questions that are very often on the fly. Appreciate it. Hopefully you can hang out for a minute past the all clear. Yeah. And then other than that, I want to remind our audience, one, please do subscribe and help us to fund these forums, continue to fund these forums. The other piece of it is to hang out with us next Tuesday. Do drop by, and you will be able to, during Hunger and Homelessness Awareness Week, we'll be checking in on our local homelessness issues. Kara.
Thanks, Steve. And thank you to Representative Dan Rayfield, Danielle Brown, Charlie Fautin, and Adam Brady for taking time from their busy schedules to be with us tonight and answer all of our questions. Thanks to our advocate staff that do all the work behind the scenes and make these nights possible. And thank you to our subscribers, Peak Sports, and First Alternative Natural Foods Co-op for their support. We really appreciate it. And with that, the City Speak is adjourned. Good night.